Ladies and gentlemen of the press, I'll try very hard not to do it Eric Omondi style. Fellow Kenyans, welcome to our daily briefing on the status of coronavirus in the country. Today, I want to acknowledge some of the gains we have made in a collaborative effort to combat the coronavirus pandemic. When we began this journey several weeks ago, we were fully cognizant of the fact that participation of our citizens in the fight against the disease would be our key success factor. We were not going to register any score against the pandemic without us all pulling together. Together with the interventions we have put in place and our constant plea to Kenyan people to take personal responsibility has been heard throughout this nation, loudly and clearly. We are glad to note that people are incrementally coming to the realization that this disease is here with us, and the scope of its devastation is real. This alone is a significant gain against a virus which has been thriving with no regard to class, color, race, or religion. And I want to emphasize that this is not a government that is trying to make its citizens act. This is a government that wants to act together with its citizens. This is not a government that is trying to force people to do things. But this is a government that wants to work together with the communities and to do things together, each of us taking responsibility for the other. So I want to thank Kenyans for embracing our messages and for becoming true allies against this virus. By and large, we are witnessing our people washing their hands more often, maintaining social distance requirements in public places, staying at home, observing hygiene measures, wearing masks, obeying the curfew regulations, as well as travel restrictions. So we must not lose sight, even as we begin this journey, even as we see the challenges ahead, we must not lose sight of how well our citizens are supporting these measures. That is not to say that, that everybody is doing what they are supposed to do. And the danger still remains because of those who are not adhering to these restrictions. So I encourage those that are lagging behind to step in and move with the rest of the country. Now that we are fighting on the same side, this thing does not have two sides. It's only got the same side, those who want to live. We expect to register more gains in the coming days. However, it is important to state that we cannot afford to drop the ball at any time soon. If anything, we are called to move more vigilantly and to sustain the measures until victory is obtained and our curve has been flattened, which it has not. We must jealously guard against any gains that we make and ensure that we do not take steps backwards. This is not a time to be complacent at all. However, we have also noted with serious concern that there are those who continue to challenge the law. Border operators are not fully observing the directive not to carry more than one passenger. And we have made it clear, if you disobey that law, your border will be taken until further notice. So there is absolutely no reason why you would want this to happen. You are also supposed to be wearing masks, which are now quite available around the country, and the ones we have distributed around the counties. We have also noted that they are the ones being used to flout movement restrictions into and out of designated counties of Nairobi, Kwale, Mombasa, and Kilifi. Let me remind you that we will not hesitate to introduce stiff measures in this regard. We therefore encourage all compliant operators to compel their colleagues to observe the already set measures in order to protect the businesses that will be messed up by those who do not obey the law. So border operators, the chairman, you have been told again and again that these are the measures that are supposed to be observed. And unfortunately, when you close a sector, you don't close the sector and say only the bad people are going to lose business. Everybody loses business. So in this regard, you are your brother's keeper. Ensure that that the next border is obeying the law. Fellow Kenyans, I wish to state that we have noted the level of exposure of face masks being sold in the streets. We must ascertain and we continue to monitor the quality of the masks, and we urge people to take the necessary precautions to maintain the levels of hygiene. There has also been questions asked about the best way and how to actually make use of the masks. And I'm going to ask my colleagues to weigh in on that when I'm done with my statements. Today I also want to address a special case and a special sector of our economy, and that is the Juakari operators and others, our saloonists, Mamamboga, our economy, our barbers in the barber shops. Our economy to a large extent depends on you. But also, a lot of the abuse and non-distancing is happening in your sector. We cannot allow Kenyans to die because of non-distancing in any sector. So I am appealing. Those of you who are carrying out the hair-cutting business in barbershops, in saloons, I am appealing to you today that ensure that social distancing, fumigation of your working places, masks are used at all times. The idea of people sitting, waiting inside your premises, sitting together very closely, waiting for their service, that is just a problem. Because as they sit waiting, this is where the virus is working at its best. Na mimi ningetaka kusihi sana wale wako katika soko, mama mboga, kina mama wetu, dada zetu, wale wanafanya hii kazi katika masoko. Sisi hatutaki nyinyi muumie. Na kuna njia mbili ya kuumia. Ya kwanza, utapata hii virusi usipofanya vile tunasema. Ukiendelea na kazi na mtu anakuja humjui na anachika mboga, mnazungumza na yeye yeye hana mask, mwingine atakuja na mwingine atakuja. Kijiji nzima inapitia hapo, na wewe mwenyewe huvai mask, na ukai bali na mtu yule mnazungumza na yeye. Hiyo ni kumaanisha ya kwamba ikiendelea namna hiyo, wewe utapata hii virusi. Na ukipata hii virusi, hiyo biashara unafanya ya kusaidia watoto wako, hutafanya hiyo biashara, kwa sababu utakuwa mgonjwa. Na hao watoto unawashunga saa hii, watoto wako na watoto wa jirani na watoto wa kina familia yako, hutaweza kuwashunga kwa sababu kwanza utakuwa mgonjwa. Tutakuombea upone, lakini vile tumeona nchi zingine, yenda ikawa hatutapona. Basi tukifika hapo, watoto wale ulikuwa unafikiria ndio unashunga saa hii, au watoto ndio utawaasha peke yao. Hawatakuwa na mtu wa kuwashunga. Kwa hivyo jameni, mkiona hii tukisema wewe ujitahadhari, ujishunge, ujikinge. Jameni, sisi tunasema hivyo kwa sababu hatutaki dadako umwashie watoto wako. Hatutaki ndugu yako umwashie watoto wako. Na tukiendelea hivyo, wewe ukishika hiyo virusi, ni kusema ya kwamba pengine hata ndugu yako ataendelea pia kupata virusi. Sasa mkipata nyote, hata watoto wengine watapata. Wale wataishi na njia mbaya sana, na maisha mambaya sana, bila masomo, bila kulindwa, kwa sababu kuna mtu fulani ambaye tulimwambia ajikinge na njia hii ambayo tunasema, na yeye akakataa, akaona kama ni maisha kawaida. Kwa hivyo mimi nataka kusihi watu wetu, sana sana wale mnafanya kazi katika soko, open markets, soko hizi zingine, watu wale wanaingia hiyo soko, ingefaa wewe useme ya kwamba, ama ujue ya kwamba hao watu wanaingia wana virusi. Just assume that everybody is positive. Assume that everybody is positive, and now deal with that situation. Deal with a situation where everybody is positive. The person next to you is positive. The person buying your vegetables is positive. Yule ambayo mnamnyoa nywele, yeye ni positive. Yule ambao ni the hair, when you are making this hair, ladies, yule ambao unamtengeneza nywele yake, akiwa amekaa hapo na wewe uko hapa, anasoma gazeti, wewe unaendelea na kazi yako, asipokuwa na mask, wewe huwezi kujua kama ni virusi. Sasa unachika dakika hiyo. Kwa hivyo jameni, mimi ningetaka tu kusema kila mtu ni lazima ajihadhari, kila mtu binafsi ajihadhari, na pia kila mtu alinde yule mwingine. Ukinilinda nitakulinda. Na hii virusi haitembei peke yake. Hii virusi inatembea na watu. Watu wasipotembea, basi virusi haitatembea. Na ndio sababu tumesema wakati huu wa Pasaka, kwa sababu hakuna kazi watu wanaenda, ni lazima watu wakae nyumbani. Ukiwa kijiji yako ama estate yako, wewe kaa hiyo estate yako. Kwa hivyo ukiwa hapa Buruburu, usiende Umoja, wewe kaa tu Buruburu. Ukiwa unakaa Lavington, wewe kaa Lavington, hapana enda Gong. Kwa hivyo utasaidia serikali na ujisaidia wewe mwenyewe. Ukiwa kwa wakati huu wa Easter, tuone ya kwamba watu wakae nyumbani. Stay at home. You have no reason to go anywhere. Hakuna mambo ya party. Hakuna mambo ya mbuzi, ati tunaenda kula mbuzi pahali fulani. Hakuna hiyo. Kwa hivyo kama hakuna mbuzi na hakuna party na hakuna bar na hakuna chochote, unaenda kufanya nini? Weka nyumbani. As I finish, I want to say that we appreciate in a very special way our corporates, philanthropists, volunteers, researchers, health workers, and medical staff for their support. From the young fashion designer distributing free face masks in Kibra slums, to the corporate giants like Safaricom PLC, who continue to make huge sacrifices in aid of this fight, the country is indebted to you. Our researchers who are not sleeping, developing local solutions to this menace, and my staff in the Ministry of Health, I thank you all, and I want you to know that we do not take your work for granted. We know the sacrifices you are making. Let me also laud the effort being done by the county government of Kitui through the Kitui County Textile Center, Kikotech, and their governor, Governor Charity Ngilu. The facility is now producing an average of 30,000 face masks per day. And indeed, those of you in social media will have seen that even the World Health Organization has appreciated and recognized their efforts. I want to encourage institutions and businesses to place their orders through Kikotech, and for businesses to support communities. Those who are wondering how to support, call Kikotech. And their address, I've got their address here. I can give it to the media as well. I've got even their telephone contact, which I can also give you, so that you can purchase for communities, purchase for your organizations, purchase for your companies. These are KEBS approved face masks. I also take this opportunity to acknowledge the bold step taken by our newspapers and our media houses today for their united clarion to call the clarion call to fight the virus. This is unprecedented. It shows the unity of a nation. It shows the unity of different segments of our economy and the unity of our support. This further amplifies our call for unity against the pandemic. Fellow Kenyans, in the last 24 hours, we have tested a total of 308 samples, out of which 5 people have tested positive for the coronavirus disease. 3 are Kenyans, while 2 are foreign nationals. And 3 of them had traveled, 1 each from Tanzania, and 1 from the UK, and 1 from the United Arab Emirates. 3 of the cases are in Nairobi, while 2 are in Mombasa County. Only 1 of these cases came from mandatory quarantine facilities, while the rest 4 were picked by our surveillance teams from contact lists. This now brings the total number of those who have tested positive for the disease in the country to 184. The ages of the 5 new cases are between the ages of 39 and 77 years old. 3 are male, while 2 are female. In terms of the age breakdown of the 184 cases, 3 are below 15 years of age, 49 are between 15 and 29 years of age, 119 are between the ages of 30 and 59, while those above 60 are 13. From the gender perspective, 107 are male, while 77 are female. I could add that the 5 people have already been moved to isolation facilities and contact tracing has already begun. With regard to contact tracing, a total of 2,046 persons have been monitored. Out of those, 1,448 have been discharged and 598 are currently on follow-up. An additional 4 persons have been discharged in the last 24 hours, having moved from positive to negative status. This brings also a total of 12 persons who have been discharged and recovered so far. This is good news. But I'm also sorry to say that we also lost 1 person in Mombasa in the last 24 hours. The person had passed on before. They had not noticed that the person died too quickly after going to hospital, had other cases as well, but died, and upon death during the postmortem is when they realized the person was also positive. So that is 7. It brings to 7 the number of people who we consider having died from the COVID-19 disease. I'm also pleased to say that we have managed to close down a number of quarantine facilities, which include the Trademark and Hill Park hotels. In this regard, we are kindly appealing to fellow Kenyans to warmly receive those of us that were in those facilities and have since been released to go home. There should be no stigmatization of anybody. As I said, this being Christmas, I want to wish you all, this being Easter weekend, is actually the Easter weekend, I would like to wish you all a good Easter, but keeping in mind that we have proposed that you stay with your families, you stay indoors, and you do not party as is our usual. Clearly, you will not be traveling anywhere else. So why not just stay at home? So I want to finish there and take 1 or 2 questions.